So in my work this summer in the infectious diseases seminar with Jordan, we spent a lot of time talking about equity, justice, and access to healthcare. And so I knew even before the seminar began that this was an opportunity for me to explore a very special story of Philly history with a very special group of students who are going to shape Philly's future. Elizabeth Tyler was a nurse, Black nurse, one of the inaugural class of Freedman's Hospital in Washington, D.C. Her path to saving lives in Philadelphia and impacting the tuberculosis epidemic in the early 20th century would take her across 6 states, 2 university teaching positions, and 2 state health bureaus, all as a Black woman without access to the voting booth, property ownership, or even LinkedIn. But wait, this sounds like an awful lot of history for a 12th grade English class. What my students and I discovered as we explored different ways of writing and research with Tyler is that communication shapes all history, and especially medical history. Tyler's respectful, empathetic, thoughtful, and equitable communication with her patients in Philadelphia was a game changer. She entered the houses of Philadelphians suffering from tuberculosis as a guest, not a detective or a judge. And as you will hear from our speaker, Ameen Fleming, her persistence and her insight helped families throughout the city. In their deep analysis of this communication and then their own research into the impact of communication on a current or a historical question, Vaux Big Picture High School seniors identified the ways that words shape our worlds. While communication is vital in many fields, nowhere are the stakes higher than in medicine. And that is one reason that I invited Ameen Fleming to our meeting today. I've had the pleasure and privilege of knowing Ameen since he began at Vaux as a 9th grader. He has asked challenging questions. He has supported his friends and his peers. He has very rarely been in the hallways when he wasn't supposed to be. And as part of our inaugural class of the phlebotomist training internship, he has even drawn my blood, which is not usually something you brag about with a student. But Ameen's thoughtfulness and his care for others and his deep questions about the problem of the world change every room that he enters for the better. He is already, 216 days before graduation, a certified phlebotomist and a valued member of our class community. When I asked Ameen what he wanted to research, he told me, "You already know." And I did, because I knew that he was going to educate his peers and me, and now he is here to educate you.
Good morning, everybody. Good morning. So y'all know the saying, good cop and bad cop, right? Today we're going to be saying good doctor, bad doctor. The good doctor being Elizabeth Tyler. Elizabeth Tyler was a Black nurse who came to Philadelphia to help the sick patients that had tuberculosis. She was a Black nurse who worked for the Henry Phipps Institute. At first, when she first came, back in the day, Black people didn't trust doctors because of what they did to them. So when she came, nobody had her trust. They didn't want nothing to do with her. But she kept coming back. She insisted, and over time, they gained her trust. Her communication. So this is a topic I really wanted to talk about. Henrietta Lacks. She was a Black woman who felt something in her cervical areas, and she went to the doctors, and the doctors told her she had cervical cancer, but that wasn't the case. They took her cells, and they tested her cells without her consent. And basically, there's one word I want to tell you about, which is benevolent deception. If you never heard it before, benevolent deception is when you belittle a situation, basically. Like, you don't make it as serious as it is. So, like, for example, say if I go to the hospital, right, and I say it's something wrong with me, they tell me it's nothing really wrong with you. Then I go to another doctor, and they tell me it's something wrong with me and it's life challenge. And the other doctor, they can get in trouble for that because they didn't tell me what was going on with my body. And that she was tricked out of her life, basically. They gave her treatments that killed her. They tested her family, took her family blood, and they didn't get nothing from it, basically. Like, nothing at all. All right, with my future, what I want to do when I get older, I want to be a family man. I want my kids to not want for nothing. And I also want to go to college, get my degree in business, and I want to combine my certificate in phlebotomy and my degree in business, and I want to make my own mobile phlebotomy company. And yeah, that's really all. Thank y'all.